Hello, I'm Pete Cantu. I'm the Mayor of Plainsboro Township, and I want to welcome you to another Spotlight Special. Today I'm pleased to have with us Barry Rabner, who is the President and CEO of Princeton Healthcare Systems. And Barry is going to talk today about an update on the recently opened hospital here in Plainsboro. I know it's been about 14 months, Barry, since the hospital opened, and there's been a lot going on. So maybe you want to fill us in on how it's going. What kind of feedback are you getting? What kind of activity levels you have in the hospital?
Yeah, yeah. I'm smiling because, as you know, we spent 9 years planning the new hospital, and then to think that we've actually already been here over a year is unbelievable to me. But May 22nd, we moved in, and that day was a big deal. We had spent 18 months planning for the move, and we're hoping that we got it right, but we did. And everyone transferred from the old hospital to the new one safely, and then we were off to the races in terms of making sure that the building was working the way we had hoped and we had planned. And Pete, it's been great. You know, I'll talk about some of the things that didn't go exactly according to the plan, but before I do that, let me tell you about the good stuff. Yeah. I think the surprise to us was the day we opened, literally the day we opened, May 22nd, the emergency department was the busiest it had ever been in our history. We had 165 patients come in. And we were prepared for more, but we weren't prepared for a lot more. And the volume has stayed like that, a little more, a little bit less, almost every day since we opened. So
has the activity levels exceeded the expectations that you had?
In every way. The numbers are, the emergency department volume is 20% higher this year to date, than it was for the same time at the old hospital. And that's at a time where across the state, the volumes in the emergency departments have gone up 4%. So the average in state's 4, we went up 20%. And the inpatient volume went up on average 6%. And that's about what we planned, but across the state, the volume went down 2%. So it's really very significant. And then, so volume is good from a business standpoint, but it's about what you're doing to people when they get here. So we measure patient satisfaction. We use a company called Press Ganey, and they do it for most hospitals around the country. And what's been incredible for us is our inpatient satisfaction scores in the last quarter of this first year here rank us in the 99th percentile in the state of New Jersey.
That's wonderful.
So it's great.
You must be doing something right, because we don't have as sophisticated a measurement system, but I talk to a lot of people.
So you get it anecdotally?
I get feedback. I get feedback about people that have used the hospital, and the feedback is universally just outstanding. But also I get feedback from the community, because as you know, this is a big deal for Plainsboro Township, and it's something that, you know, people anticipated, but you never know what their reaction is going to be once it's here. Right. But the reaction in the community has been extremely good. I mean, they view this as an asset. We view it as an asset, and obviously with the activity levels you're having, it's a regional. It was something that was needed in this region.
Oh yeah, we still see the same people that we saw historically. Whether it's from Princeton or Lawrenceville or Cranberry, but there are just more people who are coming, and it's been.
How's the staff reaction? Great.
Here's an objective way of answering that question. Mm-hmm. The simple answer is terrific, but there's an organization of nurses around that surveys nursing satisfaction around the country, and by hospital. And our nurses this year scored the highest in terms of job satisfaction of any nursing department of any hospital in the country. Wow. And I'll tell you, of all the things that I'd like to brag about, I think that's the most important one, because everybody knows how impactful it is when the staff that are taking care of you are happy, and
you're right. Bricks and mortar important, but in the end, it's the staff, it's the people that make it happen, and that's
absolutely
that's great.
Absolutely. So, and that's in a year when they had all that responsibility of moving us and figuring out how to use the place. The only disappointment we had was in ourselves in two ways. One, because the emergency department was so busy, we had increased our staff in anticipation of an increase, but not as much as we ended up seeing. So then we had to recruit more people. So there were wait times for people who came into the ED that were longer than are acceptable. And that's been fixed most of the time. Sometimes you still get this huge pulse of people, but that got better. The other thing we didn't get right in our planning was signage. You may have heard it. You may have experienced it yourself.
We've heard
but
that.
Some of the signage off the campus, getting people here, and then on the campus, and then in the building.
But you're going through
It
evaluation.
just wasn't good enough.
Yeah.
And with your help, and we've made changes around the campus, and then in the building, we've been doing it continuously.
It's
so it's getting better.
It's
getting better.
But those things are. They need to be. What other challenges do you see remaining for you with regard to the hospital specifically? I know there's other things.
The thing we were the most concerned about was getting the emergency room service at the right level. Clinically, we felt good. We were doing the right thing, but people were waiting, and that was just waiting too long. So we feel a lot better about that. It's almost 700,000 square feet of new space. So I think we're taking advantage of it, but it just requires more fine-tuning. Hopefully it's nothing that people feel. But what's really, and you're very familiar with this, but we're on 171 acres, and we've been developing it as a health campus in addition to the hospital. So in May, we had the first full month of operation of the Fitness and Wellness Center. And you're a member, aren't you?
Absolutely. I was here last night, as a matter of fact. I feel it today.
You look buff. But we have about a little bit fewer than 4,000 members so far. I use it. It's people love it. So that's up and running. And we have the medical office building that was built by Trammell Crow, and that's about 150,000 square feet, and it's almost 90% occupied. We rent some space in there, the rest by physicians. So that's great because it's a nice amenity for the people in the community. They can see their doctors there. Children's Hospital of Philadelphia is going through the approval process with the goal of building up to 100,000 square feet of outpatient space. And that seems to be going well.
It's exciting.
We'll know in September if everything's set, but it feels right. And that's going to be great for the community to have access to. I think they said 18 different pediatric specialists and subspecialists.
It's amazing because when we went through the planning process for this with you, obviously we recognized this was more than just a hospital. And these components you're talking about, the new components that are here, Merwick and the medical office facility and the fitness center, and now the advent of potentially CHOP coming in, which seems to be really likely to happen. It's been coming through our planning board process. That's really exciting. But beyond that, I mean, there's been a number of, this was a comprehensive plan. So literally, there's more things to happen. Can you talk a little bit about the status of some of those future
We've
items?
been talking to folks. We forgot to mention Merwick, which is the long-term care and subacute care facility, which is on the campus. It's been open almost 2 years. No, it's a little over 2 years.
Yes, it is over 2 years.
And they've been doing a terrific job. They had similar challenges in the beginning, trying to get everything to work right. But they've been working very hard on that, and I think they're really pleased with the services.
I had an opportunity to go through it a couple of months ago. It's really an impressive facility. And they have continued to make it better, I think, since they've opened.
I was just there this morning, and I was really pleased with the statistics, the data on how their patients, their residents are doing, and some other operational changes that they're making. So that felt really good. We have a 32-acre park that we're this close to finishing planting, and it's spectacular. It's just got it's almost a mile walking path that goes through it. It's got all
that is a public
trees.
Facility, right? Part of Plainsboro.
It's Plainsboro's park,
which we're very excited about.
And it's just, I love to see it. Sometimes I take advantage of it, but when I drive by or look out one of the windows and I see, people I don't know. I see people from Merwick, residents in wheelchairs there. I see our employees at lunchtime or on breaks
It's
there.
doing what it was designed to do, for passive recreational opportunities, and the wildflowers are just beautiful.
Wildflower, right? The people have to go if they see you this soon. They have to go there and walk
back
there.
to a little bit back to the future.
Right.
There's other things planned for this site.
One section of the site is set aside for assisted living. And we've been talking to folks for over a year and now have a company that's got a lot of terrific experience that we hope to sign a letter of intent with. I keep saying this week. I've been saying this week for like a month, but shortly.
That's
And
great.
I think they're going to do something very special here.
That's a business that had a long dry spell for a long period of time. So it's great to see it coming back, and great to see you have a potential opportunity there to do that.
That feels just right. And then we have a section that's set aside for age-restricted independent living. And we have some preliminary conversations, but there's no one that we like that likes the site yet. So we're working on that.
Good.
And then we have a developer who's going to be presenting a plan to the township for adult daycare and child daycare.
Yeah.
And that's going to be great. And then the last thing is the office research site. And we're talking to folks about that. So I think in order of what people are likely to see, it'll be the Children's Hospital of Philadelphia. I think assisted living. I think the town's going to be very pleased with what they see from them. And then the rest is so dependent on changes in the economy. But we like the use. We think it's all everything's very complementary to everything else. So we don't want to compromise on that.
I think it's important to note, though, that all of this was kind of envisioned originally in the redevelopment program. I mean, there's been very minor changes to that redevelopment program as we've gone forward. So this is part of a comprehensive plan that's coming together in a very positive way for the region, and certainly for our community. We're very pleased to have it here. It's also generating a lot of interest in Plainsboro. So we see other things happening here in Plainsboro as a result of the magnet that the hospital and this redevelopment area is providing to us. So we're pleased about that.
We have new friends in Plainsboro because I'll hear from some of the restaurants in the area.
Yes.
I'll hear from some of the short stay hotels and the banquet hotels and some of the shops in Plainsboro Village. So that's nice. But we've also had interest from, I've been counting, I think it's up to 15 different countries have come to visit the campus. And it's not just the hospital and some of the things that we did here, but it goes back to what you were saying. They love this health campus concept, and
it's really proving to be a magnet for business, and that's one of the objectives. We really want to see some of these benefits flow to our local businesses, and they seem to be starting to flow in a major way. We're pleased about that. You know, we can sit here and talk about how great this is, and it is. It's really a great facility, and we're pleased to have it here. But there's other people that have talked about it. You've been a recipient of a number of awards as a result of this. So maybe you want to talk a little bit about that?
We've gotten awards for the one that I think I'm most happy about, and you may not even be aware of this one. I know you are the others because you've come with us, because it's really an award to Plainsboro as much as it is to what we've done here. But there's an organization called Magnet, and it evaluates the quality of nursing departments. And it's a pretty rigorous process to receive it, and we were awarded Magnet status, which puts us in this elite group of about 5% of the hospitals in the country. So that's a big deal. There's a journal called Becker's that's a healthcare journal, and this year, for the first time for us, we were put on their 100 top hospitals in the United States list.
So I think you told me about that before.
There's no way I didn't tell you, because I tell everybody else.
I know you told me about that.
But that was terrific. And then, you know, for the work that we've done on the park, for some of the sustainable work done on the campus,
well, you received
engineering awards.
Yeah, multiple planning and environmental awards. It really have been. And we're delighted about that, because this is...
You've helped us get them,
well,
so thank you.
We're pleased. We're pleased about that, because I think it reflects what we wanted this to be. And I think it's been recognized that we're achieving that goal, and that's terrific. You know, you folks have had a long-standing reputation for being supportive in the community and the region you live in. And you continue to do that. I know you've been very helpful to us in a number of respects. You talk a little bit about some of your involvements in the community and region?
Yeah, it's there's so many. I think the thing that I feel we do that I hope is the most useful to people is we have health-related programs that we educational programs that we provide here at the hospital in our education center, but then in the community, in the Ys and churches and mosques and anybody that'll have us. And many of the programs are presented by physicians, some by nurses, mostly I think by physicians. And it's on any health-related issue that people are interested in. So it could be on how do I know if I'm having a stroke, to how to nutrition and weight loss and lifestyle to reduce the chances of getting cancer. And we did 1,200 programs this year, and it was attended by 36,000 people. And it's all open to the public. Some of them have a charge to them, but it's always very modest, and most of the programs are free. We also have a clinic that was supported by a really generous grant by Bristol Myers Squibb. And we provide free care or low-cost care to people who don't have insurance or undocumented immigrants. And interesting, it's been a very